Hello guys, today we would like to look at PEM and SAM. Okay, so I've put it to say PEM versus SAM because I want to understand what you can do. Because there are questions in your exams which come to say, okay, they brought you protein energy malnutrition, which is PEM, or they've brought you what is known as severe acute malnutrition. Okay, so they'll say severe acute malnutrition. So then how are you supposed to write the essays? So that's what we want to look at today. Want to see how you can write your essay and how should you come up with the signs and symptoms. Because sometimes you discover that it's not easy for a student just to write if they bring SAM, and then they would just be writing without knowing what they should be able to write in their care. So we'll go and write to say, okay, what is it that you're supposed to write? So let's see, before we can even start discussing these. So if you have a question to say, write on PEM, should you write as an emergency or not? So if you're writing PEM, mostly it's not regarded as an emergency, but you're supposed to write that part of initial care and subsequent care. But what about if you're writing SAM? How should it come up? So if you're writing SAM automatically you are saying that it's severe acute. So anything when we come across to say severe acute, meaning that this is an emergency and you're supposed to resuscitate. So you should be able to know that you're supposed to resuscitate and you should be able to write the subsequent care. That's SAM. Resuscitate, meaning resuscitation as the heading. After you resuscitate, then go to subsequent care. That's what you're going to have in our management. So you can write it the same way as PEM, but mostly PEM we do not resuscitate. We just say initial care, then that part. But for SAM, you need just to specify to say resuscitating. Okay, so let's go to the definition to see if we can talk about first of all PEM. So let's talk about PEM. In the first place, what is it when we say protein energy malnutrition? So when you look at protein energy malnutrition, we are looking at issues pertaining to nutrition, or it's a nutritional disorder. So when we look at PEM, we're just saying that it's a nutritional disorder. And then what happens here? It's because this baby is taking less than body requirement. Okay, meaning that the nutrients that you're giving this baby, or the food that you're giving this baby, is less than body requirement. So it's a nutritional disorder where the amount of nutrients given are less than body requirement. Then what are the signs or characteristics that you can have? So the characteristics will be weight loss, then there can also be edema, then retarded growth. So these are some of the characteristics, but these are not all. You can have some more and you'll be able to see as we discuss. So this is what we call PEM. Then what are the causes? For both SAM and PEM, the causes are the same, because you know that it will just go into a complication. SAM will come as a complication of PEM. So the causes are the same. Okay, so let's look at the causes. So the common causes that we have is a worm infestation. And it's most likely that most children are not dewormed. So if children are not dewormed, you discover that they will have malnutrition, because the worms compete. We use the word compete, or they also want the food that the baby or the child is taking. So they'll be competing for food the child is able to take. That's why we're saying worm infestation. What about infections as a cause of malnutrition? We know that as infections are there in the body, what will happen is that this child, the most significant word is anorexia. This child will become anorexic, meaning that they will lose appetite. And if they lose appetite, meaning that the child will not be eating. And then if the child is not eating, meaning that the child will lose weight. So that's when this PEM comes up, and then there'll be no necessary nutrients. Then again, when there is an infection, when there is a fever, which is called when the child becomes febrile, they'll need a lot of energy. So there will be a lot of breakdown of calories. So meaning that the child will need extra. If we don't give it extra, meaning it will go into malnutrition. Then another cause would be bad traditional practices. So bad traditional practices would be you know, most of the times in these traditional countries, like for example Zambia, where we follow tradition, you discover that mostly you give parents food or proper meals, and then or even proper relish, but then you discover that you give the child maybe bones. So that's what we're talking about. You give the father or the mother meat, but children are given bones. So meaning that you discover that children will not benefit from the bones, but they'll need the meat. But you are depriving them of the meat, you give them the bones. So that's why you can have these bad traditional practices. So you need to give children the meat, not the bones. So that's the cause of malnutrition in that case. Then there's also failure to increase the amount of food. You discover that after a child stops breastfeeding, meaning that the child has been weaned off, then you fail to increase the amount of extra foods. If you fail to increase the amount of extra foods, the child will become malnourished. So that's why you're supposed to be ready. After weaning off a child, you need to provide extra foods so that the child benefits from those foods. Other things would be lack of knowledge. So how can lack of knowledge cause malnutrition? So a lack of knowledge, we're talking about food preparation. Okay, food preparation is very important. You discover that some people do not know how to prepare food. They will just give children maybe a big lump of nshima without proper relish to combine maybe a protein or even just a vitamin. So they do not provide such. So in terms of food preparations, most of the people do not know how to prepare food for children. So that can be the cause of malnutrition. Meaning that as you prepare food, you need to combine vitamins, there should be protein, there should be carbohydrates, and in right quantities, not just a big lump of nshima without these other extras. So that's what I mean there. Then let's look at other causes. So other causes can be early weaning. You know, early weaning meaning that you're supposed to wean off a child, maybe say the recommended time is 2 years, or even just maybe 1 year 6. But then you wean off a child at maybe 8 months or 6 months, or some would wean off at 7 months. Meaning that this child do not have even the capacity to eat a lot of foods. And then after weaning off, you need to provide sufficient amounts of food. But then this is a little baby we're talking about, meaning that they cannot eat as an adult. So once you wean them off early, they will not benefit from the breast milk. Then they will not eat as much as a big child can eat. So meaning that this child will be deprived of food. So you need to advise women not to wean off their children early. That's what it means. Then another cause can be early sudden separation from the mother. So you separate the child from the mother. Then what can really cause this separation? The example is death of the mother. For example, the mother dies, so meaning that this child will not benefit from the milk from the breast. Or again, even the care will not be that much, so that the people who remain with the child will not provide food for this child as the mother would have done. Another cause, which is most of the time causes malnutrition, is diarrhea. Diarrhea, you know that it causes poor absorption or digestion. That's what happens there. So most of the times you discover that diarrhea would be the common cause, because they'll lose a lot of nutrients, they'll lose a lot of water, and some can even vomit as they have diarrhea. So that's what happens there. Then another cause can be poverty. So poverty, it's clear because we know that most families will be unable to provide food, okay? So they can't afford, or they cannot be able to provide food for their family, meaning that these children will become malnourished. They will not have enough nutrients in their bodies because they won't have what to eat. So that's what is there. Then if we look at the other type, before we go to the type, so I earlier on said that the causes for SAM and PEM are the same. Okay? Then let's look at the types. So if you look at the types, these can be the types. Marasmus, we can have Kwashiorkor, or marasmic Kwashiorkor, or obesity. Then after this, you know, there will be a complication which we call SAM, so that's what we look at, and that's what we'll talk about as well. Okay? So let's now go further, let's try to see what marasmus is. So these, you find them in one-word answer, multiple choice, as well as you discover that they bring this as an essay. Okay, they bring, they say PEM or SAM, they bring to you as an essay, so you're supposed to know the signs and symptoms, the differences, and all that. They ask you about that. Then what about marasmus? So in terms of marasmus, they'll ask you to say what is it. We'll look at marasmus. They'll say marasmus is a severe form, okay? Severe form of protein energy malnutrition. So in marasmus, what happens is that the key nutrient that is lost is carbohydrates. Even if we would say that they lose the protein, they lose the fat, but the key for marasmus is carbohydrates. So mostly we have to link this to this. Even when you are writing, you need to know that marasmus is a carbohydrate. Okay, that's the main nutrient that is lacking here. So children lack carbohydrates in marasmus. I'm emphasizing because students tend to swap as they are writing their essays. Then you know, the characteristic will be severe weight loss, then stunted growth. That would be the issue here. And then you know that marasmus mostly would develop at least at the age of 6 months, because mostly, you know, babies are weaned off. So we talked about weaning. So the issue is that weaning is the root cause here, because after weaning you discover that most babies are not provided with food, so they go into marasmus. So marasmus is linked to carbohydrates. Let's look at the pathophysiology. What happens in marasmus? How are the proteins, or sorry, the carbohydrates affecting this child in marasmus? Okay, so the issue is that when there is inadequate intake of what? Carbohydrates, which we emphasized in marasmus, what will happen is that it will lead to reduced availability of nutrients to the body tissue. So the issue is that the body tissues do not have carbohydrates. That's the issue here. Then what happens if the body lacks carbohydrates? The body will begin to what we call adjust, meaning it will start adapting, or it will start adjusting, because the body is not really having enough carbohydrates. So it will start adjusting not to the situation of not having enough carbohydrates. So what happens is that it will go into a situation which is called reductive adaptation, meaning that when it goes into reductive adaptation, it is trying to adjust. That's what we mean. And why is it adjusting? Because it is lacking carbohydrates. Carbohydrates are lacking, so it has begun to adjust, meaning to say, okay, we're not having enough carbohydrates, so the body begins to go into reductive adaptation. Okay, so it adjusts. Okay, so what happens now is that it goes into adjustment because the body wants to survive. Okay, and also it wants to adjust into this what we call inadequate nutrients. That's why it goes into adaptation. So it goes into adaptation because it wants to survive. Okay, that's what happens. So the human being, I know God has made it clear. It's okay. When this happens, it goes into that. So this is what happens. When there is no enough carbohydrate to adjust like that, then what happens now for it to adjust? Meaning that there is a hormone what you call thyroxine. This production of thyroxine is reduced. The hormone thyroxine, what happens is that it enables metabolism of carbohydrates. So if there's reductive adaptation, meaning that the production of thyroxine reduces, meaning that the body will not, metabolize or break down a lot of available carbohydrates, meaning it has reduced in terms of production of thyroxine. So meaning the body will not be able to metabolize or break down the available carbohydrates as much. Okay. Another one that reduces is the production of insulin. We know what insulin does. Insulin will take, the sugars in the blood to take it into the tissues, for utilization for energy. But then when there is reduced amount of carbohydrates to get, this sugar, then the production of insulin reduces, so that the little that is in the blood should remain in the blood and maintain what we call the blood sugar levels. So it will maintain. So that's why it reduces. Thyroxine, we've talked about it, which is a metabolism. Insulin, we've talked about it, to just take the glucose from the blood into the tissues. Okay. Then what will happen is that after all this reductive adaptation, what will happen is that the growth of this child will be suspended, meaning that this child will stop what? Growing. Meaning that the growth of this child is suspended, and that's what we call growth retardation. So it will go into growth retardation. So that's why they go into growth retardation, because the growth is suspended, because all these metabolic processes are suspended. Then what happens now for the body to get energy? Where will it get energy? So that's what I was saying, that to meet the body demands, what does it get energy? Meaning that the body now will begin to break down what? Fat and the muscle. So if we're not eating enough, or if the child is not eating enough, fat and muscle will begin to be broken down, so that the body gets enough energy. This is what happens. Then if the fat is being broken down and the muscle is being broken down, what will happen is that now the child will go into severe wasting, because it is losing the fat and the muscle. So it goes into what we call severe wasting. It loses that fat and the muscle. Okay. So then what will happen is that even if you measure these, say for example, serum level of protein, glucose, these will remain normal here. That's what happens. They will just be normal because the body is controlling itself. But then what you notice is that the baby will go into severe wasting. That is the marker. Okay, that is the marker. So let's just continue. We finish off the pathophysiology here. Okay, then what happens now? If say there is progressive loss of fat and muscle, what will happen? What will happen is that the body also now start losing what? Electrolytes. So that will be the issue. It's losing fat, the baby is becoming smaller, or the child is becoming smaller, then even the electrolytes are being lost out. Then the body has gone into what we call reductive adaptation. So what happens to the immune system? So the cell-mediated immunity, which I talk about the immune system also will go down, meaning that it will reduce. So meaning that's why we're saying that the condition will worsen, because the immune system what? Drops. So the immune system will drop. We're talking about the immune system here. The immune system drops because of reductive adaptation, which is here, which we talked about. So then the body begins to be prone to infections. Okay, so that's what happens. So there will be presence of infections. So the body is prone to infections because of reductive adaptation, or the immune system has dropped. So those are the things that we talk about in the pathophysiology. Then let's look at the signs and symptoms. This is in Marasmus. So signs and symptoms in Marasmus, we talk about there is number 1, severe wasting, which we've talked about. Why is severe wasting? In the pathophysiology, we said that fat and muscle, which is tissue, are going under decomposition, or they're being lost. So if fat has been lost and tissue, you are going to have a situation of severe wasting. Then how will the child appear? This is why we have old man's face or monkey face. We have monkey face or old man's face. So this you find it in multiple choice, where they say which condition or situation causes old man's face or a monkey face. So it is the Marasmus. So you find it in one word answer or multiple choice. This one, they want you to come up with this one where we say old man's face. They'll ask you to say which one has that. Then second one is the skin becomes thin, flaccid. Okay. Then if you look at this skin, so you look at the skin of the buttocks, it will form what is known as baggy pants, meaning that it will more like a baby is having a bag on the buttocks, but it's skin. Skin has really sagged because there is no tissue, there is no muscle, there is no fat. So skin will sag, forming baggy pants. So even this, they'll ask you, which condition forms baggy pants? So it is marasmus. Okay, so you need to know about this. Then this child, the characteristic is that the child will have a good appetite, though emaciated. You know, it is thin, but it has a good appetite. So in the marasmus, children have a good appetite but emaciated. Then the child in marasmus looks alert and may cry, for food. They are late and they'll cry for food. That's what happens. Then the child may also have diarrhea due to infection. Okay, so these are the signs that we have. Then there is what we call stunting. Why is there stunting? We earlier on learned to say that carbohydrates, when they are not being taken in, this child will become stunted, or there will be growth retardation. So that's what we learned. Then another thing is that there will be what we call superficial foamy spots in the eyes or on the conjunctiva. So these are called bitot. Some will say bitot or bitot spots. So these come as a result of lack of vitamin A. So now if you look at this, they also ask you, in which condition do we have bitot spots or bitot spots? So this is marasmus. So these are the signs that you need to really take care of. So number one, in marasmus, I talked about old man's face or monkey face. Spoke also about baggy pants. Then there's good appetite. The child is alert. Then there's growth retardation. Then bitot spots. These are the ones that are really prominent. But there are other signs as well. So this is a child who's marasmic. Okay, that's the child. Then if you look at now check out, there's edema there. The child the muscle is wasted. There's no muscle, if you can see. But then the child has got ascites there. Then look at the face. This face looks like an old man. Okay, so that's what I was saying, old man's face. But then you can see the ribs, meaning that this child is really emaciated, or there's really muscle wasting. That's what happens. Then let's look at now the diagnosis. If you look at the diagnosis, meaning that we're going to clinically see edema. That's peripheral edema, meaning that as we see the child, we're going to see edema. Then under history, you're going to ask about who remains with the child, what kind of job does the mother do, or how's the feeding pattern. So you need to go into history and find out a lot of things. Then we'll look at now the serum protein. If we do the serum protein, it will be normal. Like we agreed, this does not change. But what about the electrolyte and the urea? There will be an imbalance. We agreed to say that after some time in marasmus, there will be electrolyte imbalance. Then let's look at blood slide. If you do a blood slide, meaning you're just trying to check if there is malaria, because malaria can also cause, if the child is very sick and for a long time, they can have malnutrition. So just trying to see, okay, is there malaria and all that? Then what about the HB, which is blood hemoglobin? Just trying to check out if there is anemia. What about blood culture? If you do a blood culture, meaning just to see if the presence of bacteria is in the blood. Okay. What about a chest X-ray? We're just trying to rule out pneumonia. So some of these can be done, but not all of them. So just do, excuse me, just do some of them. You can't do everything. So just do some. That's what happens here. Then let's go to another one. We call it Kwashiorkor. Some will say Kwashiorkor, some will say Kwashiorkor. So it depends with how you call it, but this is Kwashiorkor or Kwashiorkor. So we agreed to say marasmus is to carbohydrate. Then Kwashiorkor is to protein. So Kwashiorkor is to protein. So this is a type of protein energy malnutrition, okay, and it occurs at least after 12 months. We agreed to say marasmus, at least it occurs most of the times just after 6 months, but Kwashiorkor is after 12 months. And Kwashiorkor is as a result of deficiency in protein. So we are going to mark this. Kwashiorkor is to protein, deficiency in protein, and then marasmus is as a result of a deficiency in carbohydrates. Then what are the characteristics here in Kwashiorkor? We are going to have edema, apathy, then moon-shaped face. Moon-shaped face. That's what you need to mark. Okay? So this is what goes on. Let's look at the pathophysiology. If you look at the pathophysiology of Kwashiorkor, let's try to see what goes on here. So here, since we know that this is the deficiency of protein, so what will happen here is that when there is a deficiency in protein, meaning that there will be poor tissue replacement, because you know that most of the body tissues, I can say all of them, body tissues are made of protein. So if there is a deficiency in protein, you know that at least there will be poor tissue replacement and development. There will be that. And most of these, like enzymes, hormones, they're all protein. Okay? So there will be a reduced synthesis of digestive enzymes and plasma proteins. So because you know that all these are proteins, so there will be a reduction in those. Then lack of digestive enzymes, what will it lead to? If there will be no digestive enzymes, there will be GIT upset. Then atrophy, meaning that it will shrink. The GIT mucosa will what? Shrink. Then intestinal villi, where absorption takes place, will also shrink. That's atrophy, meaning it will shrink. Then what happens now if there are no intestinal enzymes there and all that? There will be what we call culminating, okay, malabsorption, which will lead to diarrhea. So that's what happens. So malabsorption will lead to diarrhea because of these enzymes which are lacking in the GIT. So that's what really happens in this. Because of the proteins which are not available, so these enzymes are proteins. So if the enzymes are not available in the GIT, there will be malabsorption, meaning there will be no absorption of food, leading to diarrhea. Then what will diarrhea now cause? So diarrhea now will cause what we call loss of electrolytes. An example of such electrolytes would be potassium. Okay, so there will be lack of these, electrolytes, so there will be loss of electrolytes. Then again, we look at the liver protein content. What happens there? Okay, meaning that it is what? Reduced as well. It is reduced while fat is increasing. Fat increases while protein reduces in the liver. So what will happen is that there will be an increase in the liver, okay? The liver will increase in size, leading to what we call hepatomegaly, meaning the liver will grow bigger because this fat is increasing in the liver while the protein is reduced. So now, what happens now in the blood? When we have what we call reduced plasma protein, what will happen in the blood? So in the blood, when there is a reduced plasma protein, what will be happening is that there will be what we call reduced oncotic pressure. Oncotic pressure, this is just the pressure that supports, the content of the blood vessel to stay in the blood vessel. This is the oncotic pressure, meaning the content of the blood vessel will remain in the blood vessel. Then if this now reduces, what will happen is that if the oncotic pressure reduces, meaning that what is in the blood, the content of what is in the blood will also now shift. So this is what we call, it will lead to fluid shift, meaning the content from the blood vessel shift now into the extravascular spaces. So extravascular spaces meaning just in the tissues, leading what? To edema. So that's why you have edema, because this oncotic pressure has reduced. Okay? And then leading to a reduction in the fluids, in the fluids found in the blood vessel, because the fluid will go into the tissues, leading to edema. That's what happens here. So that's the issue with proteins. Proteins will cause edema if they are reduced. Okay, that's the thing. So pitting edema, where will it be found? In the ankles, okay, in the feet, and it will spread to the rest of the body. So we know that the cause is plasma protein, which has been lost. Okay, then what happens to this child? The child will become apathetic. They will not be interested in what's happening. They'll become anorexic, meaning they will not even be able to eat. Okay, that's what is happening here. Then the child will have what is known as a moon-shaped face. A moon face. Okay, what is the cause of this moon face? It's because of edema. You know how the moon looks? It's round. The moon is round. So it will cause a moon face. Okay, that's what happens because the moon is round and the baby's face will be round because of edema. Okay, then what happens to the hair? It will be thin and sparsely distributed. Then also the hair will be brownish, okay, because of lack of protein. We know that hair is also made of protein. Then what happens to the immune system? The immune system will also be impaired because of lack of protein. Okay, because you know that all these cells, they are formed as a result of proteins. So there will be low immune system. So the child will be prone to infection. Then what happens to the skin? There is what you call hyperpigmentation of the skin, meaning that these will just be patches on the skin. And then these patches are called what? Dermatosis. So dermatosis, these are patches on the skin or as a result of hyperpigmentation of the skin. So that's what will be happening here. Then let's look at now the temperature. What happens to the temperature? We know that the immune system has dropped, meaning that there will be no fever. If the immune system drops, no fever. Okay? So it will happen that the child will go into hypothermia or to become hypothermic, but then they'll have an infection. Instead of causing fever, they'll have hypothermia. They'll have a low temperature. This is as a result of a low immune system. We know that if the immune system has dropped, there will be no fever. That's the principle there. Then those have a distended abdomen. This may be as a result of edema. Then weight loss. So that's what they're going to have here. Then they can also have a stunted growth and then delayed puberty. So if you look at now these signs have come from the pathophysiology. Okay, that's where they've come from. So all these signs have come from the pathophysiology. If you look at the signs and symptoms here, they've come from the pathophysiology, all of them. So because we've discussed the pathophysiology above here, which we talked about, say there'll be a reductive adaptation and all that. So all these signs which we are trying to talk about, the child will have all these signs which we've talked about now, the pitting edema, which we've talked about, then the anorexia, which we've talked about, then the moon shape, which is coming from that edema. All these signs are coming from the pathophysiology. Then if you look at the hair, which is as a result of lack of protein from there as well. Then the impaired immune system, which we've talked about, leading to, maybe like say lack of protein, which lack of protein leads to impaired immune system or low immune system from the pathophysiology as well. We've talked about the dermatosis. The dermatosis also comes from the proteins, because we know that there will be hyperpigmentation, which we've talked about. Then we've talked about also hypothermia, which is as a result of a low immune system. Then we've talked about a distended abdomen, edema, loss of weight as a result of undernourishment. Then we've talked about stunted growth. This is because of inadequate food intake. Then we've talked about delayed puberty as a result of growth retardation. So these are the signs that come about. Okay, now let's look at this child who is who has Kwashiorkor. So these patches, as you can see, they look like veins. This is what we are calling dermatosis. So this peeling off of the skin, as the skin is peeling off, we call it dermatosis. So this is what we refer to as dermatosis. So the child, as you can see, the child is edematous. You check the face, the child is edematous and the skin is peeling off. So this is typical of Kwashiorkor. Let's look at the diagnosis. So the diagnosis, the same. You can just do the same things like we did in marasmus. So you can just check clinically. Clinically, you see peripheral edema, so you'll be able to conclude. But this edema, you need to rule out other causes of edema as well. Then you can look at the history. So history, they will talk about what might have predisposed to a child having Kwashiorkor. Then serum protein, in this case, will be low because the child is losing protein or lacking protein. What about urea and electrolytes? There will be an imbalance because we know that they are losing it through diarrhea. So through diarrhea, they lose urea and electrolytes. So you need to look out for that. What about the glucose? So under glucose, we know that you need to look out for hypothermia. Glucose, when there is hypothermia, it is used a lot. So you need to know that if there is, you need to test for glucose because in hypothermia, you know that there will be a demand of glucose. So you need to do blood sugar. Then blood slide as well to rule out malaria. What about hemoglobin? To rule out anemia. Blood culture, just as we did in marasmus, just to check out the presence of bacterial infection. What about X-ray? X-ray just to rule out pneumonia. So these are the investigations that we can do. Okay, so now let's check out the differences. So in sometimes you can be asked to compare and contrast, or even just say write the differences. Whichever way they give you, compare and contrast, write the differences about Kwashiorkor and marasmus. So these are the differences. So you need to write a table. Most of the times you write a table so that it's clear to the marker. So in terms of the cause, we now know the cause of Kwashiorkor is protein. The marasmus, it is primarily what? Carbohydrates. So that's what we agreed. Kwashiorkor, protein, marasmus, carbohydrates. What about the skin? In Kwashiorkor, we have agreed that it will be peeling off, meaning that those bends, like I showed you, they were looking like bends. That's what we call dermatosis, meaning that in Kwashiorkor, there will be what we call dermatosis. What about in marasmus? In marasmus, it will be wrinkled and forming what we call baggy pants. I told you it will be like a child is having a bag on the buttocks, you know, so that's what we call baggy pants. Then what about edema, presence of edema? In Kwashiorkor, because it's protein, it's always present because we're looking at protein. What about in marasmus? Okay, so in marasmus, you may not, sometimes you may not see it because we're dealing with carbohydrates. Then what about the appearance? If you write about the appearance, how will the child appear? In Kwashiorkor, we are saying that it will have a moon face because of edema, so it has a moon face. Now, because of, in marasmus, because of loss of fat and carbohydrates, it will have what we call odd man's face. That's what's there. Okay? Then what about now in terms of interest? Interest in the environment, what occurs here? In Kwashiorkor, it's apathetic and inactive. In marasmus, it's alert and active. That's the interest. Then what about appetite? In Kwashiorkor, we know that it's anorexic, so it won't be eating. But in marasmus, it is, it has a good appetite, and it will be crying just to see the food. It would want to eat food. What about hair changes? In Kwashiorkor, we're saying that because of protein makes up our hair. So hair will be sparsely distributed, it will be reddish, and it will be falling off because it's protein. What about in marasmus? No significant changes appear. So these are the differences. So you need to know this table and you need to master the table. So let's look at another interesting part of Kwashiorkor. About malnutrition. So like I earlier on said, sometimes students, when you're brought, when you're going in an exam, you find that they've brought to you severe acute malnutrition, which is SAM. You're really going to get confused, and most they get confused because they don't know where to start from. They don't know what this is. So SAM, it's severe acute malnutrition, meaning that it's more of a complication of protein energy malnutrition. From marasmus and Kwashiorkor, then you're going to SAM. So it's a condition. Okay, SAM is a condition in children. Okay, that can be identified by what we call a low weight for height. low weight for height. When you measure the height and you compare it to the weight, it will not tally. So it will be, the child will have a low weight for height. Then a low mid upper arm circumference. There is a tape which we use to measure the arm there on the humerus. So that's what we call mid upper arm circumference. So there will be a low mid upper arm circumference. Then there will be pitting edema both feet. Mark these words. Pitting edema both feet. That's the thing. That's the definition about this condition, SAM. Okay. So when you're looking at SAM, I've seen questions where they ask you to write about the clinical picture of SAM. So the clinical picture of SAM, they'll say, okay, what is the clinical picture of SAM? There will be edema both feet. So you need to write about this. There will be edema both feet, and you know why there's edema. Edema is coming as a result of lack of protein. Okay. Then there will be what we call weight for height. This is it. Weight for height, length. It will be less than -3 z-scores. So there are those things, those lines you put on the under 5. There are those lines where when you weigh the child, you're supposed to measure the weight and you compare it with the height. And sometimes these z-scores can just be on a separate paper where you can have these z-scores. So when you compare the weight for height, you discover that it will give you less than -3 z-score, meaning that the child is having SAM. Then MUAC, less than 115 millimeters. MUAC is upper arm, mid upper arm circumference. So it's the one that we use on the humerus. So it will give you less than 115 millimeters. So meaning that this is SAM. Then when you offer a child what we call ready to use therapeutic food, which is RATIF, it will be unable to finish RATIF because it's malnourished or severely malnourished. So when it fails to finish, we conclude this is SAM. Well, when a child is having breastfeeding problems, so you compare, okay, this is SAM. So these are the signs that you have. Another one is medical complication present. So whenever there's a medical complication present in malnutrition, okay, so that's what I'm saying, severe pneumonia with malnutrition. Whenever there is a severe pneumonia with malnutrition, which is a medical complication, we conclude this is SAM. So those are the signs. So this is what you write in your exam. Then let's have some examples. So in SAM, what you have is edema both feet. As you can see, there is pitting edema both feet. So this is SAM. Then you go to MUAC, which is mid upper arm circumference. This is where they take the MUAC. So this is a mid upper arm circumference. So this is the tape. Then use the tape to measure there. So if it gives you in green here, meaning that the child is okay. Yellow meaning that the child is going into malnutrition, but then they're not yet there, but then they're going into malnutrition. So, but when you go now into red, okay, meaning that this is now what we call severe acute malnutrition. And if you check out the tape, it has to give you 115 millimeters. So anything less than 115 millimeters, meaning that it will give you something in red. Okay, so meaning that if this is in centimeters, it has to be 15 centimeters. If it gives you something less than that, we're going to say this is malnutrition. Then we go to the next one, which we're looking at the z-scores. The z-scores are these. Okay, obviously you've seen them on the under 5 or just on a separate paper. If it gives you -3, which is say less than -3, which is here. -3, meaning that the child is severely malnourished. So this is what we have. Then let's look at now the management. Whenever you're writing management, be it just PEM, be it SAM, the first thing that you really have to look at is the stem of the question. But whenever you're writing SAM under management, you need to go into this. What you really have to look at is the initial treatment and specify to say, I am resuscitating. Okay, you need to specify that you're resuscitating. That's the thing that you do. Okay, that's the first heading, initial treatment, and you even put in brackets if you want resuscitation, so that the marker knows that you are resuscitating and this is severe acute because it's an emergency. So what are you resuscitating for? You need to take care of the sugars, meaning you need to write treatment and maintenance of hypoglycemia. So you need to treat the sugar, that's the resuscitation. Then we also learned to say that they will lose a lot of electrolytes. So you need to treat electrolyte imbalance. Then there is low immune system, so they'll be prone to infection, so you need to treat infection. Then they go into hypothermia because they've lost the fat, they've lost, the immune system is low, so there is no fever. So they go into coldness, so you need to treat hypothermia. Then they may have diarrhea, so which we are going to say you're going to treat the lost body waters. Okay, so these are the things that you really have to write in your resuscitation. So sugar, meaning that you talk about treatment of hypoglycemia. Then electrolytes, you're going to say treatment of electrolytes. Infection, treatment of infection. Coldness, you're talking about treatment of hypothermia. Lost body waters, you're talking about rehydration. That's what you talk about. Then after you finish your resuscitation, go into subsequent care. Okay, under subsequent care, now this is where you just write your eprophenema, meaning the child is now resuscitated, and just writing now the general care. So you can put as many points as you want there. So this is what you do. So here I've got a sample, just what you can write. Maybe say in the treatment of hypoglycemia, this is what you can write. You are going to do totally feeding to treat hypoglycemia, but you have to be careful. What are you feeding the child in the initial stages? Okay, what are you feeding the child? So we feed the child F75 in the initial stages. So after the child has improved, maybe after 7 days, you start F100. So the initial feed, they will even ask you in a one-word answer, the initial feed is F75. What about the continuation phase? What do you feed? Meaning that you feed F100, but the initial starter feed is F75. So these are the things we can do to treat hypoglycemia. You can even insert an NG tube so that you feed your sucrose there, sucrose solution. Okay, so you can do a lot of stuff under hypoglycemia. Then there is also prevention of hypothermia. This is under resuscitation. What do? You keep the child covered. You need to put rationales to everything. Close windows, take temperature, then feed. When you feed, you're preventing hypothermia. That's what you do. Then what about treatment and prevention of diarrhea? Diarrhea, we don't use ringer lactate in here. So in malnutrition, go to the multiple choice or even one-word answer. They'll ask you, what fluid do we use or what solution do we use? Okay, what's the fluid of choice in treatment of malnutrition? So when you say treatment of diarrhea, they'll confuse you. Say treatment of diarrhea, what's the fluid of choice? You go for ringer lactate for treatment of diarrhea only. But for the treatment of diarrhea in malnutrition, the fluid of choice is Rizomo. So this is Rizomo. Rehydration solution for malnutrition, that's what you choose. So that's the answer. So you find this in one-word answer and do that. So this is how we give it, 5 to 10 ml per kg. Okay. Then other things you look at is correction of electrolytes. We talked about this, so we know that we're not going to give sodium chloride because this child has a lot of sodium chloride in the body. So you just give something with potassium and magnesium. Okay, that's what you give. You can also supplement potassium, you can supplement magnesium. Okay, so under correction of electrolytes, sometimes you just go for Rizomo because it has low sodium. It is low in sodium, so that's why you give Rizomo. Okay, don't give ringer lactate here. And then treatment of infection, you can give Septrin, which is cotrimoxazole. So you can just write as much as you can, but this is the resuscitation part. Okay, then for electrolytes, you can give vitamins to boost the immune system. So you can give folic acid, you can give zinc, you can give vitamin A, you can give multivit. So again, for vitamin A, they'll ask you what are you giving it for? To prevent bite dot spots or bit dot spots. Then how do you give the dose for a 1-year-old? You give about 200, okay, international units. That's 1-year-old, okay. What about 6 to 12 months? You give 100. Okay, what about 0 to 5 months? You give 50,000 international units. So this also comes in your one-way answer, sometimes even multiple choice. So 0 to 5, you give 50. 6 to 12 months, 100 international units, 100,000. 1 year and above, you give 200,000 international units. So just supporting sentences. Initial feed or starter feed is F75. Okay. Then stabilizer food, or after the child has stabilized, or the follow-up feed is F100. Okay, so that's what happens. So these others you can provide. But after you're done with the resuscitation, what do? You go on your next heading where you write the subsequent care and write a prophenema. So you can write the prophenema, and that's how it is. A prophenema, or learn how to write it. That's just general care that we give. So you've been with Mr. Coco. So thank you very much for listening. And if you are a subscriber already, just click like so that others can see the video, and also you can share. And if you're not a subscriber, kindly subscribe and share the video. So we have agreed to say that you need to learn how to just identify whether it's an emergency or not an emergency, if it has acute in it or severe in it, just so that this is an emergency you're dealing with. So those are the indicators for you, and you have to just learn those. So thank you very much for listening and for being with me. Have a pleasant day.